Good afternoon, everyone. My name is Brittany Richardson Michael, and today I will be doing a presentation on African trypanosomiasis. In this presentation, we will explore various aspects of African trypanosomiasis, including its name, scientific classification, discovery, structure, pathogenesis, epidemiology, and the treatment and prevention strategies for African trypanosomiasis. So before we start, I would like to go over the objectives of this presentation. So the objectives are as follows. Understand the cause and transmission, identify the clinical signs and symptoms of African trypanosomiasis, explore the impact of African trypanosomiasis on public health, evaluate diagnostic methods, examine treatment options for African trypanosomiasis, describe strategies for prevention and control of African trypanosomiasis, analyze the challenges in controlling and eliminating African trypanosomiasis, and investigate ongoing research and initiatives for tackling African trypanosomiasis. So, what is African trypanosomiasis? In so many words, is the sleeping sickness, but it's a neglected tropical disease that affects thousands of people in sub-Saharan Africa. Also known as sleeping sickness, this disease is caused by the protozoan parasite Trypanosoma brucei and has significant implications for public health in affected regions. Name and scientific classification. The disease is commonly referred to as African trypanosomiasis or sleeping sickness due to its characteristic symptoms of disrupting sleep patterns. The causative agent of African trypanosomiasis is a parasite called Trypanosoma brucei. Now, as you can see, various people played a part in discovering African trypanosomiasis. So we're going to start with Sir David Bruce. Sir David Bruce was an eminent Scottish physician who first identified the causative agent of African trypanosomiasis while investigating a mysterious illness affecting cattle in Zimbabwe. His groundbreaking work led to a better understanding of the disease's transmission dynamics. Next, we're going to discuss David Livingstone. David Livingstone was a Scottish missionary and explorer who was the first to claim that Nagana is caused by tsetse fly bites. In 1852, he reported the presence of a sickness in the basins of the Limpopo and Zambezi rivers, as well as on the banks of the lakes Nyasa and Tanganyika, excuse me, from which all of the cattle he transported died after being bitten by tsetse flies. However, it took another 40 to 50 years to identify trypanosomes as the cause of Nagana and sleeping sickness. In 1895, Scottish pathologist and microbiologist David Bruce identified T. brucei as the cause of bovine trypanosomiasis, which is another name for cattle Nagana. In 1901, British Colonel Surgeon Robert Michael Ford excuse me, examined a steamboat captain and discovered trypanosomes in human blood for the first time with certainty. He initially assumed the organisms he discovered were worms, but English physician Joseph Everett Dutton identified them as trypanosomes, a few months later and proposed a species named Trypanosome gambinis. In the same year, Aldo Castellani, an Italian physician and pathologist, discovered trypanosomes in the cerebral fluid of sleeping sickness patients and proposed that they caused the sleeping sickness. 1 year later, Bruce presented conclusive evidence that tsetse flies transmit sleeping sickness. So now on this slide, we will discuss the taxonomy. As you can see listed, the kingdom is Protista, the phylum is Euglenozoa, the class is Kinetoplastia, the order is Trypanosomatida, the family is Trypanosomatidae, the genus is Trypanosoma, and the species is T. Trypanosoma brucei. Okay, now we're going to discuss the structure of African trypanosomiasis. The structure of African trypanosomiasis involves several stages in its life cycle, including transmission, infection, proliferation, and pathology. Transmission. African trypanosomiasis is primarily transmitted to humans through the bite of the infected tsetse fly. These flies are endemic to sub-Saharan Africa and serves as vectors for the parasites. Infection. When an infected tsetse fly bites a human host, it injects the metacillic tribomastigote form of the parasite into the bloodstream. The parasite then multiplies within the bloodstream and lymphatic system. Proliferation. Within the human body, T. brucei undergoes several development stages. Initially, they transform into bloodstream trimastigotes, that circulates through the blood vessel and other tissues. These tripomastigotes reproduce by binary fission and continue to proliferate rapidly. Pathology. As T. brucei multiplies within the host bloodstream, it invades the immune system by continuously changing its surface glycoproteins known as variant surface glycoproteins or VSGs. This antigenic variation allows the parasite to escape recognition by host antibodies and maintain chronic infection. The presence of trypanosomes in various bodily fluids leads to different clinical manifestations depending on the subspecies involved. T. brucei gambins cause a chronic form of sleeping sickness characterized by gradual onset symptoms such as fever, headaches, joint pain, fatigue, and ultimately progresses to neurological dysfunction. T. brucei rhodazine causes an acute form with rapid onset symptoms including fever and neurological complications. So it is important to note that the life cycle and structure of African trypanosomiasis can vary slightly depending on the subspecies involved and the host immune response. However, the general progression involves transmission by tsetse flies, infection in the bloodstream, proliferation, and antigenic variation within the host, leading to various clinical manifestations. Now we will discuss the pathogenesis of African trypanosomiasis. The pathogenesis of African trypanosomiasis, also known as sleeping sickness, is complex and involves multiple stages. It is caused by infection with the protozoan parasite Trypanosoma. which are transmitted to humans through the bite of infected tsetse flies. Excuse me. After an infected tsetse fly bites a human host, the parasite enters the bloodstream and replicate rapidly. The first stage of infection the first stage of infection, also known as hemolymphatic phase, occurs when the parasites multiply in the blood and lymphatic system. During this phase, individuals may experience symptoms such as fever, headache, joint pain, itching, and swollen lymph nodes. If left untreated, the infection progresses to the second stage, which is the meningoencephalitic phase. In this stage, the parasites cross into the central nervous system, including the brain and the spinal cord. The ability of Trypanosoma brucei to invade the central nervous system is facilitated by its ability to invade immune response and adapt to survive within the host tissue. Once in the central nervous system, trypanosomes can cause a range of neurological symptoms due to inflammation and damage to brain tissues. These symptoms include sleep disturbances, hence the name, sleeping sickness, confusion, personality changes, tremors, seizures, and ultimately coma if left untreated. The pathogenesis of African trypanosomosis involves several mechanisms that contribute to disease progression. Firstly, trypanosomes have a remarkable capacity of antigenic variation. They possess a large repertoire of surface glycoproteins known as known as variant surface glycoproteins or VSG. Through genetic recombination events within specific gene families encoding VSGs, trypanosomes can switch their surface antigens frequently during infection. This enables them to evade recognition by antibodies produced by the host's immune system, allowing them to persist and multiply within the host. Now we'll discuss the epidemiology. The epidemiology of African trypanosomiasis, also known as sleeping sickness, is complex and varies across different regions within the sub-Saharan Africa. It is caused by the protozoan parasite Trypanosoma brucei. According to the World Health Organization, African trypanosomiasis is responsible for over 98% of reported cases. The distribution of African trypanosomiasis correlates with the different ecological zones. African trypanosomiasis is found in West and Central Africa, primarily affecting rural populations living near rivers or lakes where tsetse flies thrive. The incidence of African trypanosomiasis has significantly decreased over the past decade due to intensified control efforts. According to World Health Organization data from 2019, there were only 977 reported cases worldwide, representing a substantial reduction compared to previous years. However, despite the progress, challenges remain in controlling the disease effectively. Factors contributing to the persistence of African trypanosomiasis include limited access to healthcare services in remote areas, poor surveillance systems, inadequate funding for control programs, and ongoing conflicts that hinder intervention efforts. Additionally, population movement and changes in land use may contribute to the spread of infection. Efforts to combat African trypanosomiasis include strategies such as active case detection, screening high-risk populations through mobile clinics or health centers, vector control using, excuse me, using insecticides or traps targeting tsetse flies, and treatment with anti-trypanosomal drugs. Integrated approaches Combining these measures have proven effective in reducing disease burden in some endemic areas. Let's discuss the treatment for African trypanosomiasis. So you have the early stage and you have the late stage, as you can see. The treatment for African trypanosomiasis depends on the stage of the disease and the species of trypanosome involved. According to the World Health Organization, the main two drugs used for this disease are pentamidine and ceramine for the first stage, and melarsoprol and eflornithine for the second stage. It is important to note that the treatment should always be conducted under medical supervision, as these medications can have serious adverse effects. In some cases, supportive care may also be necessary to manage symptoms and complications associated with central nervous system involvement in late stage disease. It is crucial for individuals suspected of having African trypanosomiasis to seek medical attention promptly. Early diagnosis and treatment are essential for a successful outcome and preventing progression of the disease. So we talked about the treatment. Let's talk about the prevention. So to prevent African trypanosomiasis, the following measures can be taken. Wear protective clothing, use insect repellents, avoid bushy or wooded areas, and sleep in screened or air-conditioned accommodations, and perform regular checks for symptoms. Like if you have been to places that have tsetse flies or have, the African trypanosomiasis, is good to perform regular checks for if you start having the symptoms. When you wear protective clothing when traveling to areas where tsetse flies are prevalent, such as rural parts of sub-Saharan Africa, it is important to wear long sleeves shirts and long pants made of thick material that can help reduce the risk of tsetse fly bites. It is worth noting that there is no vaccine available for African trypanosomiasis as present. Therefore, personal protection measures remain essential in preventing infection. So it's good to, if you are traveling, take precaution with these, take measures by, like I said, wearing protective clothing, using repellent, avoid the area, sleep in screened and air conditioned accommodations. So, in conclusion, African trypanosomiasis possesses a significant challenge to public health in sub-Saharan Africa. Excuse me. Understanding its name, scientific classification, discovery, structure, pathogenesis, epidemiology, treatment, and prevention strategies, it is crucial for effective control for this debilitating disease. By implementing comprehensive prevention measures and investing in research and drug development, we can only hope to reduce the burden of African trypanosomiasis on its affected communities. Thank you for your time and your attention, and I am happy to address any questions that you may have.